Chicago, welcome. It is Tacora Love. I am a rotating co-host of Channel 21 Community Pulse, and I represent the Academy of Medical Surgical Nursing, Chicago Chapter 317, and also Hector Nurses for Humanities. We have an amazing show lined up for you guys today. We are so honored. First and foremost, before we begin, Happy Nurses Week to all of the nurses in Chicagoland and beyond. And Happy Nurses Week to you
Same to
well.
you.
Yay!
Same to you.
Thank you. We are so excited. In the studio today, we have Dr. Linda Yoder. This is such an honor, not only as a friend, as a mentor, a fellow nurse, but Dr. Linda Yoder, I'm going to give her bio, which is amazing, by the way, and I'm sure that you guys will agree once I get through it all. So Dr. Linda Yoder is a nurse with 48 years of experience. 48 years, guys, so amazing, and her contributions have just been so vast. She has experience in medical surgical nursing and oncology, as well as nursing leadership. She is a professor emerita at the University of Texas at Austin School of Nursing. And just in a moment when she begins to speak, you guys are going to hear that Texas accent that I love so, so very much. She served as an Army nurse for 28 years, retiring at the rank of a colonel. So we're going to hear a lot about that. We're so excited. She's also served in many different roles as a nurse, ranging from a staff nurse to a chief nurse executive and a nurse scientist. She's published over 100 peer-reviewed papers and books. We're so honored to have Dr. Yoder. She's also very, very active in professional nursing organizations, such as, well, you guessed it already, right? The Academy of Medical Surgical Nursing. She's a past president. She's also involved in Sigma Theta Tau International Nursing Honor Society, the Oncology Nursing Society, and the Army Nurse Corps Association. And more recently here, we're going to talk about this, fellow of the American Academy of Nursing and the Academy of Medical Surgical Nursing. Yep. Welcome, Linda, to Community Pulse, Channel 21.
Thank you so much. Happy Nurses Week.
Yes, Happy Nurses Week. So we are just going to jump right in. As you guys know, I'm a conversationalist and so is Dr. Linda. So we want to share all of our information as well as, get some questions answered and get Linda's feedback and insights on a couple things. So, Linda, can you share your journey into nursing and what inspired you to choose this amazing profession?
Well, I'm going to give you the Reader's Digest version, okay? But my father died unexpectedly when I was 16. And my mother found herself with 3 children and $35 in the bank. And I was a straight A student, and there was no money to send me to college, obviously. And I was working a couple of jobs while I was in high school to help with family expenses. And I had this wonderful high school counselor, and she knew that I wanted to be a nurse. And she told me about this program called the Walter Reed Army Institute of Nursing. Yes. And so she said, Linda, I think you would be a perfect candidate to apply for this program. And so I did. And that was before they let women into West Point. This was in 1973. And so I filled out the application form for the Walter Reed Army Institute of Nursing. And they said that I could come for interviews, and I went for 2 rounds of interviews, and I was accepted. And so I was so excited because that was a 4-year scholarship to nursing school, where I graduated with a degree from the University of Maryland in Baltimore, because the RAIN program used their curriculum and some of their faculty, as well as military nurses who taught in the program, and those military nurses had their master's or PhD. So I learned from military nurses and civilian nurses while I was in nursing school. And I have to say I received a great undergraduate education, and then I was assigned to Brooke Army Medical Center in San Antonio, where I was a staff nurse on an oncology unit. And fast forward, then I worked in the medical intensive care unit, and then I was assigned to Italy, and then I came back for my master's degree, and then I went to Korea, and on and on and on. And I'm so grateful to the military, because I was able to get my PhD from the University of Pennsylvania in Philadelphia, and I was there at a wonderful time and had fabulous faculty members. And then I returned to my work with the Army and built 2 bone marrow transplant units in Army hospitals and did some other exciting things. So my journey, I did everything from staff nurse, bedside nurse, to nurse manager, nursing supervisor, chief nurse executive. And because I have a PhD and I'm a researcher, I retired from Walter Reed Army Medical Center as the senior nurse scientist in their nursing research department.
So amazing and inspiring. And, you know, that's the beauty of nursing.
Yes.
You know, there are so many different opportunities and so many doors that you can go through with that nursing degree. And as you mentioned, like, your career has spanned from bedside, executive, military, academia. How has these diverse roles shaped your perspective on what it truly means to be a professional nurse today?
Well, one thing about the Army Nurse Corps is they demand high standards. They were the first nurse corps to exist. They were created in 1901, and they were the first military nurse corps to say you have to have a baccalaureate degree to come on active duty in the military. So the Army Nurse Corps always led the way, and they have had high standards from the very beginning when you look at who some of the leaders of the Army Nurse Corps were. So that really instilled in me as a young nurse that I needed to live up to certain expectations, which were really grounded in excellent patient care. I was repeatedly told, do your best every day, take good care of the patients, and just learn, continue to learn, and do your very best to take care of the people that you're serving. And that meant a lot to me. And nursing really is a service to the community. Regardless of what your community is, I think that nursing is a calling. It's not just a job. If you stay in nursing for a long time, you realize nursing is not just a job. It's a calling, and you want to do good work. You want to take good care of the people in your community.
Yes, absolutely. And I couldn't agree more. It is certainly a calling, you know, and it takes a servant's heart to do this work.
Yes.
You know, we always say that it's hard work, but it's work of the heart.
That's correct.
Yes.
That's correct.
Oh my gosh, I love it. So after 28 years in the U.S. Army Nurse Corps, you retired.
I did.
Yes.
It was time. It was time.
And what rank? We spoke about this earlier, but do you want to talk a little bit about your time, the lessons you learned in the Army that translates even still today for you?
Well, you know, when you go up through the ranks in the military as an officer, you also have to attend military schools. So in order to get promoted, you have to continue your civilian education, but you have to go to certain military schools. So I'm a graduate of Command and General Staff College, and I'm a graduate of the Army War College.
Wow.
And in those places, only about 10% of the class consists of women. It might be a little bit more now,
Okay.
but at the time that I went through those courses, only about 10% of your classmates were women. And you had to lean in as a woman and show that you were capable of being just as good as any of your male counterparts regarding leadership activities. And really, I felt like I had to represent nursing, and I had to demonstrate what did nursing provide to the military. And so we had certain assignments in those courses, and I remember some of my assignments at the Army War College, and the guys would be out playing golf sometimes on the weekends, and I would be in my room studying weapons systems. But then when it came time to look at the evacuation plan and the healthcare plan of soldiers in the field, I led the team.
I love it.
And
yes.
so really it demonstrated my value to the military team, and that they really could depend on me if something happened to them or the soldiers that they were leading, that they could count on me and the nurses that I was leading to take care of them. And that trust is really, really important. So I did learn a lot of extra things about leadership in those military courses that sometimes civilian nurses aren't necessarily faced with having to deal with. And then, of course, I had my nursing leadership positions, which were challenging in their own ways, right? Yeah.
Ah, so amazing. And thank you for your service, you know, not only to our country, to our profession.
It was my pleasure. My pleasure.
All right, we're going to shift a little bit. And having taught and advised graduate nursing students for many years, including currently, right, what competencies or like what characteristics do you believe future nurse leaders must develop to navigate through today's complex healthcare system? I know that's a loaded question, but.
So it is a complex system, and I think that nursing leaders today really need to, it sounds like a trite phrase, but they do need to be authentic. Yes. They need to work with their teams to try to create the best nursing work environment that they can. We know that nurses leave their facilities, mostly hospitals, because of work environment issues. And so as a leader, it's important to evaluate that environment and try to create the best environment for them. And also to use your senior nurses to help guide the junior nurses. We have a lot of experienced senior nurses out there, and I think we need to harness them to help our more junior, less experienced colleagues and create that collegial team kind of nursing work environment and allow people to be able to speak up about issues, especially quality and safety issues. We want to provide the best care to our patients. So it's really important that quality and safety be at the forefront of all of that. So I always emphasize to my graduate students, because most of them are working in hospitals, some of them are nurse practitioners, that quality and safety has to come first, and that we need to be authentic and transparent about some of the issues that we face.
And, you know, we do really well advocating for our patients. We have to advocate for ourselves.
Exactly.
And for the profession. So I wholeheartedly agree with being authentic and being able to have these conversations that are going to make a lasting impact for our profession.
Well, and some of the conversations are crucial, and they're not always so pleasant, right?
Yes.
Sometimes you have to tell someone when they're not doing a good job, but don't just tell them they're not doing a good job. I would often, as a nurse manager, say, okay, now what can I do to help you?
Yes. I love that.
What can I do to make it better? And I think those are critical questions that leaders have to ask their people is, how can I help you? What can I do in the environment? Or if I can't do it, I need to be able to explain why I can't do it.
Exactly.
Or what are the certain things that are at play. But I believe very strongly that nurses are the linchpin that holds the healthcare system
Yes.
together. And it's nurses that are so critical to the healthcare environment, regardless of whether you're working in a hospital or whether you're working in a clinic or whether you're working in a community not-for-profit organization. Nurses are often the people that hold everything together and
Yes.
keep things moving and organized, right? So we need to acknowledge that, and we need to, as you said, be very proactive about what nursing represents
Yes.
and why we're important.
Absolutely. Oh, I love that. I love that. As a fellow of the American Academy of Nursing and also the past president of AMSN, how do professional nursing organizations contribute to the advancement and the visibility of the nursing profession?
Professional nursing organizations are especially critical, and we are at a pivot point right
Yes.
now. And I'm just going to be very honest about what is happening here. The Department of Education recently determined that they would not categorize nursing as a professional degree. And what that means is that nurses are not eligible for thousands and thousands of dollars of scholarship money that other professions like medicine are eligible for regarding their education. And although there were 150 members of Congress that provided bipartisan support and 80 to 90,000 letters from nurses and supporters of nursing, such as the nursing organizations, to support nursing as a professional degree, the Department of Education decided that they were not going to do that. And so this is huge. Now, it's come to my attention that some of the nursing organizations, such as the National League for Nursing, the Academy of Nursing, they are now lobbying Congress to enact legislation to reverse this Department of Education decision. But this is where nurses need to join their professional organizations, be part of a professional community like AMSN or like the Academy, like Sigma Theta Tau. And a lot of those organizations already on their websites have form letters where you just fill out your name and what it is that you want your congressperson to do, and you send that in via email. They usually have a list of all the members of Congress and even the White House. And these organizations also get together and they send in letters about issues such as the one I described, which is a huge issue. But nursing organizations also provide free contact hours, free education hours, and most of the state boards of nursing, for example, in Texas, I'm required to have 20 contact hours per year to renew my license. And they check up on that.
They do.
Right?
They do.
So some of these free contact hours are very helpful, and they provide evidence on their websites about certain new things that happen in healthcare. And then also there are conferences that you can attend that are supported by these professional organizations. And when you go to these conferences, they provide you with some of the latest, greatest evidence on the new things that are coming out. So you get a lot of different benefits from professional nursing organizations. And the other thing is you meet colleagues in your area. So I have lifelong colleagues that I know from AMSN. I have colleagues from the Oncology Nursing Society and colleagues in the Academy of Nursing. And these people are very important to me because sometimes when I don't know something or I need to help a student with something, but I don't know the answer, I can pick up the phone or I can send an email to a trusted colleague and say, help me out with this, I have a question. And I can usually find a wonderful colleague that will help me. And these are relationships that I've created over years and years in these organizations. So, you know, just join one, join your main professional nursing organization, and you'll find it very helpful and you'll get a lot of benefit out of it.
Yes, and you know, I wholeheartedly agree. It's not only the network and it's the evidence-based information, but it's also like a place of belonging.
Yes.
Right? You find like-minded individuals.
Right.
You learn so very much.
Yeah.
Yes, yes. Okay. All right. So looking ahead, Linda, what gives you the most hope about the future of nursing? And what advice would you offer to students and early career nursing or nurses that are entering the profession today?
I would just say, do your best. Come to work every day with the idea that I'm going to do my very best today. Now, here's the thing. You're going to have some bad days. You're going to make some mistakes.
For sure.
Trust me, the mistakes you make will stay with you. No one is going to blame you more than you blame yourself when you make a mistake, right? I have a colleague from the University of Pennsylvania who wrote a book about nurses and what they remember. And she interviewed many nurses. And nurses that were 60 years old told her that they remember their first medication error.
For
right?
sure.
So we're hardest on ourselves.
Yeah.
But I would say, you know, give yourself some grace, especially when you're a new nurse, you're continuing to learn. There's some research that shows that new nurses double their knowledge in the first 2 years that they're practicing. So nursing school isn't the end of the story.
No.
You're continuing to learn, you're continuing to develop your knowledge, you're continuing to develop the way you interact with your patients, and you're caring and compassion for people with different problems. So just do your very best, give it what you've got, and enjoy being a nurse, even though you're going to have some days that aren't so great.
For sure.
And you're going to be tired when you come home. But think about the people that you actually helped that day.
Yeah. So my next question was going to be like, what advice, what are some key takeaways that you want our audience to remember as we end this interview?
I want people to remember that nurses are highly educated professionals. And when I say highly educated, the nursing workforce in the United States is the most highly educated nursing workforce in the world.
Yes.
And I read a quote this morning by the president of the Sigma Theta Tau International Nursing Honor Society. And she said, behind every work of compassion from a nurse is knowledge. So it isn't enough just to be caring or compassionate. Nurses are smart people. They make hundreds of decisions every day to take care of people, to save lives, to help babies be born, to help patients die with dignity. So I would say that nursing is something that you can be proud of as a profession, but it should be respected by the public because we are professional, knowledgeable healthcare personnel that really want to take good care of our community.
Wow. Wow. I couldn't be more prouder to be a nurse and even so honored to have you in the studio. Thank you for all that you do. Thank you for your inspiration. Thank you for continuing to educate our future nurse.
Well, thank you for having me today. It was a real pleasure.
Yes. We would like to take a moment to thank Hectone Nursing, the Academy of Medical Surgical Nursing, CAN TV, and of course you, Chicago. Thank you for joining Community Pulse. Be well. Thank you, Chicago. Bye-bye.